Hi, welcome to Nutritional Medicine by Lab Analysis. My name is Dr. Cyrus Thomas. I've been a chiropractic physician for some 33 years. I'm also a diplomat of the National Board of Homeopathic Examiners, and I have a medical doctorate of homeopathy from the country of India. That was quite a journey, I can assure you. Tonight we're talking about diabetes. It's been a fabulous subject talked about by many healthcare people on television for years, and we'll talk about some myths and some realities here tonight. It's an important topic because diabetes is rather rampant these days. What's important to realize is that nutritional remedies do work for diabetes. We're going to be talking about how we use medical analysis and nutritional treatment. So we're using essentially the best that modern medicine has to offer in the form of blood tests and hair analysis. We're doing our treatment with nutritional substances, which actually are called nutraceuticals. We'll talk more about that. And instead of pharmaceuticals. No one needs to be told to stop any drug or treatment. Don't stop your medications just because you start trying some nutrients. Regular pharmacy medicines are called pharmaceuticals. Nutritional pills are called nutraceuticals. And it's important to realize that in the last 30 years, we've seen an explosion in the amount of knowledge that has been available to nutritionists about how nutrition works. Essentially, we're really talking about physiology of the body, whether it's treated with pharmaceuticals or whether it's treated with nutraceuticals. There have also been many advances in modern medicine diagnostics over the last 30 years, but few advances in medical pharmacy in the last 30 years. You know that to keep a drug going, you have to give it a different name and say that it can now treat something different as well. But for 30 years, not much new has been invented there. Pharmaceuticals give support, but once nutraceuticals begin to affect a cure, then the blood and the hair tests will show that it is safe to reduce the pharmaceuticals. So you're taking some pharmaceuticals, you are getting support from them, and you decide, you get a feeling that if you went to nutraceuticals instead, you might, instead of getting support, you might get healing. When you begin to feel that and you make the switch over, start taking nutraceuticals, you don't stop your pharmaceuticals. You wait until the blood tests and the hair tests and the urine analysis can tell you that it's safe to begin reducing the pharmaceuticals. You'll feel the difference, and you and your pharmaceutical prescriber will want to reduce your intake of pharmaceuticals. Both you will and the practitioner that you're working with will want to do that for you because of the side effects of pharmaceuticals. They're great, and it's something we always have to watch out for in pharmaceutical prescribing. When we do a blood test, we're essentially testing for 52 different substances. In this case, white is optimal, yellow is at a warning, red is at risk, and blue is like code blue, dangerous. This person had 3 code blues on his first blood test, which is in this column. Months later, they were retested, and you can see that the blues had all disappeared. Many of the reds had turned to either white or yellow. Many of the yellows had turned back into white. And so this person was doing quite a lot better on nutraceuticals months after they were first tested. When you're tested, the lab will tell you, the lab and usually the doctor that you see will tell you that you're doing just fine when you are between these ranges. And when your blood values are in this range or this range, You might feel lousy, but you're told that everything's okay. And that's because you really need to be in this range, in the functional lab range. This is a much stricter definition of health than to be here or here. And usually a person doesn't receive pharmaceuticals until they're either here or here. We give people nutritional nutraceuticals to bring them from either here or here to here, or to bring them from too high to unsatisfactorily high back to, again, optimal. We do hair analysis because a vein and an artery go to the hair to make the very beginning of the hair shaft. This follicle will use what's in the blood to make the hair. So essentially the hair can pull things out of the blood. And if we see a lot of substances coming into the hair that aren't usually there, we suspect there's too much of it in the blood. And so then we know how to go about and to treat the blood. And some of the things that we look for are heavy metals, which is the top half of this test. We want all of these heavy metals, such as arsenic, lead, mercury, silver, tin, titanium. We want all of those to be back on this beginning line of 0. There are no heavy metal amounts that are tolerable to the body. And this person has quite a few in the green and some in the yellow. The other half of the test is for the good metals and the minerals. So, for example, we're talking about calcium, magnesium, sodium, potassium. We're also talking about metals like cobalt and strontium and minerals like sulfur. Those have a mid-range of here, and we don't want them to be too low or too high. In other words, you need a safe amount of these substances in the mid-range to function properly. Diabetes is expected to double. The cost is going to triple by 2034. And the current $113 billion cost is going to soar to $336 billion. This is clearly an epidemic for the United States. Something needs to be done. Some of the truths are that 40% of the U.S. adults aged 40 to 74 have pre-diabetes. We'll talk about what pre-diabetes means. 1 in 3 children born in 2000 will develop diabetes in their lifetime. Of course, now it's 2012? 2/3 of Americans are overweight, and 1/3 are already obese. So it makes you think that maybe obesity is equal to diabetes. It isn't really. There are people who have excess weight on their body and they're not diabetic. Diabetes really means that your pancreas isn't working well anymore. We'll talk about what that means. In prediabetes, it may be called impaired fasting glucose, or the IFG. The sugar level in the blood is too high. If sugar is too high in the blood, it begins to create havoc. Insulin is required to remove the sugar from the blood and bring it inside the cells. So insulin is really a hormone. It's made by the pancreas. When the pancreas perceives that the sugar is too high in the blood, it sends insulin out into the blood. The insulin grabs the sugar, it carries it to a cell, and it delivers it to the cell, and the sugar can enter into the cell so that the cell can live, so that it can make adenosine triphosphate, ATP, which is the energy of the cell made in the mitochondria. Causes of diabetes. Much of it is due to bad fats that are in processed meats, such as hot dogs, bacon, sausage, bologna, pork, processed pork. 40% of diabetes, 40% of the people who eat a lot of this will have diabetes when they frequently eat these foods. And just from hydrogenated fats alone, 39% can be blamed on diabetes can be blamed on hydrogenated fats. Pops and sodas are no good, of course, because of the sugar content, up to 16 teaspoons of sugar per can of soda. Coffee and caffeine fool the body. Coffee tends to raise blood sugar because it gets another hormone in the pancreas called glucagon to be secreted, and it begins to fool the body. So people who are pre-diabetic really have to watch their caffeine intake because it plays havoc with their sugar levels. In a healthy person, caffeine does not cause diabetes, however. Some say these items are also involved. Many drugs, beta blockers and steroids and antibiotics and refined carbohydrates are surely involved in the destruction of the pancreas, which causes type 1 and type 2 diabetes. When insulin isn't made, you get hyperglycemia. Why? Because insulin grabs the sugar, takes it out of the blood. Symptoms of hyperglycemia: thirst, blurry vision, frequent trips to the bathroom, feeling faint, fatigue, and nausea. When insulin is made in excess, the opposite of this, you have hyperinsulinism. Symptoms of hyperinsulinism are shakiness, feeling unhappy, mixed up, being hungry, feeling fatigue, sweating a lot, headaches, confusion, sleep problems, and feeling irritable. When a patient has seen numerous doctors with no success, go back to the basics. The blood tests. And in the blood test, of course, we're doing a diabetic profile. In the blood test, we're looking at glucose, sugar in the blood, of course. We're looking at the hemoglobin A1C. Now, that's a way of measuring what the sugar has been doing for the last 3 months. When it begins to rise, you can consider yourself to be pre-diabetic. We do a liver panel. We're looking for liver enzymes and liver fats. A thyroid panel, because the thyroid gland is essentially regulating the speed that your whole body operates at. We're looking at inflammatory markers to see if there's inflammation inside the body. We look at the hepatic profile, which is like the liver panel. Vitamin D levels, vitamin B1, B12, CBC panel, which is looking at the number of red blood cells, the number of white blood cells. We need to know that because the red blood cell is essentially the transporter of all the nutrients in your body. It's also the transporter of all the toxins to bring them back to where we can get rid of them. And of course, it tells us about the white blood cells, which is the immune system. We're also looking at iron and cholesterol, of course. There's an iron atom at the middle of every hemoglobin molecule, so it's an important element in the body. This is a case of an anonymous book. Call him anonymous, 59-year-old, her anonymous female. She had diabetes with extreme fatigue and a recent loss of vision and digestive problems. Her hemoglobin A1C, which we were talking about earlier, was 13.7, but when she got on the nutraceuticals, it dropped down to 6.3, which is much closer to the healthier range. The glucose dropped from 358 to 99. 99 is near optimal, 95 to 103 or so. Triglycerides dropped from 633 to 207. And triglycerides are clearly implicated in diabetes because, and it's also, you'd think that because a triglyceride is a fat, that maybe eating too many fats or animal products raises your triglycerides, but we know clearly now that it is too great a carbohydrate diet that causes high triglycerides. She was very adamant about not doing any medical pharmaceuticals or therapy. She stuck to the natural program designed for her of the nutraceuticals and supplements for vitamin C, beta carotene, garlic, herbal defense. She got echinacea, tyrosine, chromium picolinate, vitamin E, zinc, magnesium, and vanadium sulfate. When we compare glucose to the hemoglobin A1C, we can have the glucose being in low or very low, or high or very high, or optimal readings. We can have a hemoglobin A1C be optimal, high, high, very high. So we have different combinations of how those two work together. Each one of them requires a different nutritional scenario. Here is an example of scenario 2, where the glucose is very low and the hemoglobin A1C is at an optimal level. For this, we say that there is hyperinsulinism. Too much insulin in the blood is causing the glucose to be very low. This is dangerous. Nutrients that can help are chromium picolinate, vanadium, EPA, and DHA, two great oils with omega-3s, etc. If we look at scenario 8, where the sugar is very high and the hemoglobin A1C is also very high, this is an indication of diabetes. Nutrients that might help are the chromium picolinate, vanadium, EPA, DHA, glucaril, niacinamide, vitamin C, E, magnesium, and zinc. Now, sometimes we have to use the pharmaceuticals to get things, to force things to be under control until the nutraceuticals take hold. The liver never stops. These poor organs in the inside of our body, they just work 24/7. The liver stores sugar, a lot of sugar, up to 1/2 pound. And some of the medicines that are taken for diabetes these days actually go to the liver and affect how much sugar can be released into the blood and how much new sugar is made, called gluconeogenesis. Oral diabetes agents are not insulin pills. A lot of people think they are, but instead they are powdered, compressed medications that appear to affect the insulin-making ability of the beta cells of the pancreas. In other words, they cause the beta cells of the pancreas to make more insulin so that you can reduce your sugar. They stimulate the forming of the receptors, the formation of the receptor sites on the cells, so that when the insulin gets there with the sugar, the receptor cells accept that and allow the sugar to leave the blood and get into the cell, lowering the sugar level, improving the diabetes. These pills affect the production of glucose by the liver, reducing the production of, reducing gluconeogenesis, so new sugar is not made. But it's sort of forcing the body to do these things. Now, when a person gets tremendously high numbers of sugar in the blood, 400 and 500, these medicines are handy to bring it down for a while, but then we want to use nutraceuticals to make a cure. And we can make a cure as long as some of the beta cells in the pancreas are still functional. A Code of Honor by Van Merkel, a chiropractor that I like, he says essentially that it's the responsibility of the practitioner, the doctor, the physician, the healer, to take their patient's case extremely seriously, because we're talking about a person's health. And it is without health, how can one fulfill their optimum potential or purpose in life? He also, in this Code of Honor, promises not to recommend any more nutrients than are necessary, but also not to shirk from his responsibility to tell you everything that it's necessary for you to do in order to get well. So if you're on pharmaceuticals right now for diabetes and you feel that you have it under control, you might not have the bug yet to maybe want to try to cure your diabetes or to be completely off your medications. That's fine, that's your choice. But if you have the sense that maybe you should be, there is a lot that you can do and a lot that you should know. You monitor the blood sugar as you take the nutraceuticals. In time, you can reduce the pharmaceuticals. It's being done all over the country. This is my office on D Street. If you go to my website, you'll be able to see some older archived television shows. Integrative Alternative Medicines with an S .info. There's many pages there and many articles to read too on healthcare issues, and I invite you to do that. Special thanks to the Community Media Center of Marin for allowing us to use this station. We air this show every Tuesday night at 8 o'clock, and welcome you to watch these. And if somebody is not living in Marin, they can go to the website of this Community Media Center, which is cmcm.tv, and they can tune in on Tuesday nights at 8 o'clock at the same time, and on their computer they can watch these shows. So I hope you've learned something. We do shows on cardiovascular health, on cancer, on thyroid issues. We'll be doing shows on autism, and we've done some on colitis and Crohn's disease, celiac and sprue, and how these diseases can be treated with nutraceuticals. Thank you for watching, and may you be in good health.